Hi, this is Katie, and this is my life with VEDS, or Vascular Ehlers-Danlos Syndrome. I want you to know that spontaneous sigmoid colon perforation without a reason is something that is connected with Vascular Ehlers-Danlos Syndrome, a rare genetic condition that does not have to run in families in order to happen, and is not uncommon for people to not know that they have it. Now, this is not medical advice. I'm not a doctor. I am someone living with vascular EDS, and I know from personal experience that there's a lot of doctors that don't know about this condition. It's not uncommon for people to not know that they have it. It is genetic, but you don't have to have a parent with it in order to have it. I'm the first one in my family. About half of people with the condition are the first in their families, at least for the people who have been studied. And I know that a lot of times people don't get diagnosed with this for many, many years, depending on where they live and how familiar their doctor is with this kind of medical information with a rare disease. I myself was diagnosed when I was 28. I know people who are diagnosed in their 40s. I know people who are diagnosed in their 60s. I know people who are diagnosed as children. And I think that it has a lot to do with where you live, where you get your medical care, and how familiar those doctors are with this specific rare disease. So to read the language directly from the 2017 International Classification of Ehlers-Danlos Syndromes, spontaneous sigmoid colon perforation in the absence of known diverticular disease or other bowel pathology is a major criteria for vascular EDS. A family history of the disorder, arterial rupture or dissection in individuals less than 40 years age, unexplained sigmoid colon rupture or spontaneous pneumothorax in the presence of other features consistent with VEDS should all lead to diagnostic studies to determine if the individual has VEDS. Testing for VEDS should also be considered in the presence of a combination of the other minor clinical features listed above. That is directly from the 2017 International Classification of Ehlers-Danlos Syndrome. I will put that in the description of this video so that you can read the paper if you like. I'll also include resources for you to look at if you want to reach out to the VEDS movement and talk to the nurse and their Help and Resource Center. They can help guide you to where a doctor familiar with this might be, depending on where you are. And there's a lot of helpful information there, like support groups and all sorts of stuff. I want people to know about VEDS. I want the world to know about VEDS. So if you're watching this video and you've had a sigmoid colon perforation and you think you might have VEDS, or you're watching this video and you have VEDS and you know all about this condition, please share this video and help get the awareness out there. Let's have the world know about this condition. Thank you. See you soon.